Good morning and welcome back. Today we have Dr. Patrick DeMoss joining us from Atrium. Thank you for being here today.
Yeah, thanks for having me.
I'm glad to have you here because we have a really important topic today. Today we are talking about pediatric sickle cell awareness. What is pediatric sickle cell?
So sickle cell is a disease of red blood cells where slowly over time the red blood cells become much more rigid and assume a specific shape, and it makes them much more fragile, so they tend to break apart real easily or get stuck in the little blood vessels throughout the body. So it's a debilitating chronic illness that the medical community is working on alleviating.
Wow. And so is there a cure for this at this time, or where are we at? Where do we stand?
Yeah, so there's one cure. It's a stem cell transplant. Mm-hmm. And then there's 2 gene therapy products that have recently been made available through the FDA. So there are those options, but for most people, it's a managed kind of illness.
All right, and so I have to ask, how do you know, we're talking about this from a pediatric perspective, how do you know if your kid has it? Are there signs that we should be looking out for, and what are they?
Yeah, so it is usually picked up on the newborn screen. Okay. That you get or have done in the nursery or the NICU. They test for a panel of different diseases that if you catch them early enough, you can kind of intervene and prevent a lot of bad things from happening. So often parents will be notified through that way. Okay. And the primary care doctor will typically start penicillin, and then they might make a referral to our office or a hematology office. Every once in a while, a patient will kind of slip through and not be diagnosed kind of at birth, or that information isn't relayed. So some of the common symptoms kind of just depend on the age. Okay. Typically in the little kids, they might have swelling in their hands and feet, pain, redness. They might have blood get trapped in their spleen, so they might have a big spleen. As they get older, they might have pains in their bones, their like long bones, arms and legs, back, chest. And then, as they kind of keep getting older, we deal with strokes and sickling in the lung. Wow. And infections. Wow.
And so I have to ask, what resources do you have available for people that are going through this with their kiddos? What resources do we have at Atrium?
Yeah, so at the Children's Hospital, there's 3 doctors there. So we see a lot of patients with sickle cell. So we're all hematologists. So, this is kind of what we trained for. So we know kind of what to look for and what medicines to prescribe and imaging to do for surveillance. And we can see them in the clinic. We can also see them in the hospital if they need to be hospitalized. We have a social worker who helps the families access different resources that are available for patients with sickle cell disease. We have a child life specialist who is able to just kind of make it a better experience, more comfortable in the clinic. We have 4 longtime clinic nurses, and then we have our front desk ladies have been working there a long time, so they know the families real well to kind of make it a home away from home in some respects. And
really make it a personal connection with them. Mm-hmm. That is incredible. If you would like to find out more about this, or if you want to see the resources that are available through Atrium, head on over to our website, 41nbc.com.